In the following video, we will demonstrate the same technique but using total assistance with the help of two healthcare workers. Today I'm going to be working with
Sean Cleaver, faculty lecturer in the School of Physical and Occupational Therapy.
So to perform this technique, in this case, Ms. Gendron is unable to make significant changes in her body positioning, so this is why we're going to help her. Again, my bed is at the proper height, which is my hip level, and I'm going to position myself at the patient's torso. So first of all, I'm going to bring my side rail down. And so Mrs. Gendron, what we're going to do now is that I'm going to help you turn towards me. So first of all, you can turn your head towards me. You can cross your arm on your chest, and I'm going to help you bend your left knee. It's going to facilitate the rotation. In terms of hold, you have to make sure that your fingers are close together to avoid claw-like hands. You're going to position one hand at the patient's shoulder and one hand at the patient's hip, and you're going to position your body to do a forward-backward weight transfer. So in order to do so, at the beginning of the movement, all of your weight is going to be on your front leg, and as you're rolling the patient, you're going to bring your weight on your back leg. Your back needs to stay straight at all time, and your elbows has to be slightly bent. So I am grabbing shoulder, hip, I'm positioning myself for my movement, and then Ms. Gendron, on 3, we're going to turn, okay? So 1, 2, 3 on the side. So I can keep my elbow slightly bent or sometimes increase slightly the flexion in order to do so. So once the Piqué is in the middle of the patient's back, we're going to perform the same thing but using backward-forward weight transfers. So we're going to roll back on your back, Ms. Gendron, 1, 2, 3.
Now we'll roll the patient towards my side of the bed. So Mrs. Gendron, I'll get you to turn your head towards me. Cross your arms once more. Great. And now I'll have you lift up your right leg. I can help you if need be. There we go. Leave that bent like this. And using the same hold that Catherine had mentioned, one hand on the shoulder, one hand on the hips. Weight is forward. 1, 2, 3. And we're ready. And back on the back.
Is this a comfortable position?
Yes, thank you.
Perfect. Now, before leaving your patient's bedside, make sure to always put the side rail back into position.